Hello, and this is the last lecture. It's going to be very short, but I wanted to make sure that there is some information that you cover before coming to class for your next class. The next class, there will be the presentations for ankle and knee, so you'll be writing a SOAP note for that, so make sure you look over those case studies. And then we'll answer questions regarding this video and on outpatient considerations for your neuro patient or your CVA patient. And then we're going to do some grab bag scenarios where you're going to be looking at some case studies together, and then Kahoots for fun, because, you know, who doesn't love a Kahoot quiz? The things I want you to consider when you go into your first clinical rotation, which is coming up, you may encounter patients with neurological dysfunction, and depending where you're at, you might see more than your classmates. And you haven't had neuro yet, and your therapist, your treating therapist, your CI is going to know this, but I do want you to be aware of some basic concepts that you can run into. Patients who have had a cerebral vascular accident or a stroke, they may come into outpatient physical therapy as a continuation of the care that they received in a skilled nursing facility or from home health. They may actually be coming in for an unrelated musculoskeletal referral. So just because they have an ankle sprain now, it may or may not be related to the fact that they've had a CVA in the past. And those are things that you want to keep in mind if you're treating the patient. Maybe they've had a stroke in the past and they're coming in because their opposite knee hurts. But they may have muscle tone issues related to the stroke. So muscle tone, there could be increased tone or spasticity, or they may have low tone. So if you see a patient with low tone, if you remember back to if you did the ICE videos, you saw some patients who had very flaccid upper extremity kind of hanging to the side. The therapist had to remind them to put that hand back on their lap because they were not really attending to it. Especially in the shoulder, that low muscle tone can actually affect the joint, causing some excessive hypermobility and even subluxation of that joint. So you want to be really careful when you're helping those patients transfer that you're not pulling on a joint that's been overstretched because of weak muscles or a lack of muscle support. Other muscle weakness issues can come in the form of foot drop and other compensatory gait patterns. So remember when we talked about AFOs, sometimes a patient will have an AFO because their tibialis anterior is unable to fire in order to clear the toes during gait. They may have neglect. So on the side of the stroke, the opposite side of the brain was affected. So their brain may not be really ready to pay attention to that side of the body. So you may need to do things to encourage paying attention to that side. Cardiovascular endurance is often decreased, typically due to decreased activity levels. Balance impairments are very common, and oftentimes we're working on fall recovery strategies with these patients because the likelihood of falling increases if you've had a stroke, especially if it's affected the lower extremity. I have a series of videos for you to watch, and I highly encourage you following Bob and Brad. I don't get paid for that endorsement, but they do have a lot of great therapy, treatment ideas, patient education ideas. A lot of their videos are geared towards patients, but that doesn't mean you can't learn from it. This series, the 3 videos here have to do with helping patients who have had stroke. And so they have some fun, creative ways to work around the foot drop, work with the balance issues. They do talk a little bit about Parkinson's and some strategies to help patients who have Parkinson's disease. So I will let you pull up the PDF in Moodle and click on those links, and then you can watch those videos. The other thing I want to draw your attention to is in PhysioU, if you click on the neuromuscular interventions, so there's neurological rehabilitation instruction, go to the neuromuscular video library, and I would say look at the interventions and case studies, okay? And it will give you some, especially with transitional movements, standing gait, spasticity, rigidity. So if you go there, you can see some treatment strategies for working with these problems. Dorsiflexion for weight bearing, increasing passive range of motion and weight bearing into dorsiflexion and pronation. I think these are all good to look at. Again, I'm not expecting you to magically understand neuro rehab based on these videos, but being aware of what kind of therapies are involved. And then over under assistive devices, so if you go to the physiotherapy homepage and go to assistive devices, I'll walk you through that. So assistive devices, and then scroll down to case studies. And there's a couple of interesting case studies that I think would be helpful. A 73-year-old male post-stroke. That'll give you some kind of insight into what therapy is like for that person. It looks like it's an acute case, so maybe not necessarily what you're going to see in the outpatient setting. This 82-year-old male with unstable balance, I think, is a really good one to look at because that's definitely what you're going to be working on in the outpatient setting. So I'm really gearing this information towards your upcoming clinical rotation in the outpatient setting. And really, that's all I want to cover for this video. I told you it would be super short and sweet. Go back and look at the Bob and Brad videos. Look at the neuro case studies, and you can look at interventions. Let me go back and go to case studies on here as well. And if you do stroke, you can see that these are happening in, this looks like an inpatient gym, but some of these could be outpatient as well. So, just take a look and look at the quality of movement. I also want you to have an appreciation for how some of these therapists are utilizing the help of others in order to help make sure that their patient is safe. So that's another thing that's going to be super important for you to keep in mind. If you do have a patient that's got a neurological dysfunction, your clinical instructor is not going to dump you into an unsafe situation, but having some understanding of patient safety in these situations and how certain patients would present will help go a long way for allowing you to learn more in your clinical education environment. You're going to learn a lot more when you get into your neuro class, and some of this will, be solidified and make more sense. But because there is a likelihood in the outpatient setting that you could see a patient who's had a stroke in the past or who may have Parkinson's disease, being aware of those diagnoses is super important. For one thing, being aware of the diagnoses and being aware of what are the common difficulties that these patients have. Just that awareness and your baseline education on that will help facilitate you understanding what your primary PT, your clinical instructor, is asking you to do. And that is it. Where the rest of the class is going to be dedicated, to doing case studies. So we're going to be doing a lot of group case study work in the next class. We're going to do a Kahoot, and then we'll close up with doing any questions about the video or the case studies. I just want to have plenty of time for those case studies because they're the most fun to work on. Have a good day.